There could be light at the end of the coronavirus tunnel. It's faint, I know, but there is a glimmer in the distance. At least a dozen countries, including Germany, Greece, Italy, and Spain, have started to ease their lockdown restrictions. And they, of course, will be test cases for whether countries can save livelihoods while protecting lives. Germany is letting older children go back to school, reasoning that they'll better comply with rules on masks and distancing there. Denmark is doing the opposite, permitting younger children to go back in the hope they are less at risk. Spain kicked off a plan to reach normalcy by June, starting by reopening small stores and hair salons. France is getting ready to slowly lift restrictions starting this week. Gradually, people are being allowed outdoors again. But does being outdoors limit transmission? Well, officials in Lithuania say it does, and they're closing streets to allow restaurants and bars to offer outdoor-only services. So are leaders in Sydney in Australia, which is allowing surfing and swimming, but not socialising at beaches. I would think that's pretty hard to separate the two. Bangkok is reopening parks, but forbidding most social activities. And so people are beginning to be optimistic the worst might be over. Here in London, the Prime Minister, Boris Johnson, has dropped the stay-at-home instruction that has been at the heart of its messaging since the 23rd of March. More outdoor leisure activities are allowed, with golf, tennis and angling amongst the sports permitted. People in England are allowed to travel to parks and beaches and can swim and sunbathe. The elderly will certainly welcome the chance for more social interaction. For many pensioners, their only chance to see or meet or chat to someone is when they shop. Hopefully by now their neighbours will know more about them and visit more often. But that unselfishness hasn't always been repeated at national or international levels. But all in all, it's a beginning, and spirits are being lifted after almost 7 weeks of collective captivity. But it also inflates expectations of what is certain to be a frustratingly incremental, muddled, and protracted process. This is the so-called second phase, but lurking underneath is the entirely rational uncertainty about the epidemiological consequences of partial relaxation. The dreaded second spike. The rate of infection or reproduction value R is presently 0.7, but could easily rise above 1, risking that second peak if social distancing isn't observed or schools are opened too quickly. The testing regime is improving, though. I was tested in a swimming pool car park by soldiers from the Grenadier Guards. A simple swab test in the mouth and nose, and I had the result, negative, I'm glad to say, in less than 48 hours. But the testing procedures need to be speeded up and the antibodies test introduced as soon as possible. If we look back on the past 7 weeks, there have been two narratives. The first is how patient and kind the vast majority of people have been to each other. They have behaved responsibly. Some have even enjoyed areas of their lockdowns. For example, spending more time with their families. But the second narrative is one of deep concern. Many people's jobs have either disappeared or are being threatened. Unemployment is likely to skyrocket, and wage earners with the responsibility for providing for their families are frantic with worry. All the economic projections are deeply gloomy. The IMF, the International Monetary Fund, estimates that between now and the end of next year, the pandemic will cost $8 trillion of GDP. Many companies are being bailed out by their governments, desperate to save their economies, but many won't be saved, and the social impact will be horrendous. Many wealthy countries have not only pursued their own national strategies for public health, but have also withdrawn from the globalized world of diplomacy and trade that they themselves set up. At the top of all of this is the World Health Organization. It's the organization charged with protecting the health of everyone on the planet. But the WHO struggled to get its 194 member states to actually follow its guidance. Early on, President Trump accused the WHO of mismanagement and then threatened to withhold funding. The WHO responded, saying it regretted the decision, but called again for unity to defeat what it called a common enemy. Director General Dr. Tedros said, "When we're divided, The virus exploits the cracks between us, and that's true. Indeed, the UN Secretary General Antonio Guterres has already bemoaned the lack of international cooperation. And the UK Prime Minister Boris Johnson urged countries to pull together to meet what he called the most urgent shared endeavour of our lifetimes. He's right, because to put it simply, a crisis anywhere quickly becomes a problem everywhere in today's globalized world. And that's where the WHO comes in. As long as COVID-19 is out of control somewhere, it's a threat everywhere. The WHO has to lead and coordinate global efforts to find a vaccine and find ways of distributing the cure, especially to poorer countries. COVID-19 shows how much we need an effective global health body. Perhaps Mr. Trump and some European leaders might remember that. It takes global funding and global cooperation to combat global pandemics. The scientists are working hard and fast to find a cure, but we don't know yet when that magic bullet might become available. But let's hope this outbreak at least means we're better prepared for the next one.